Hello, this is Dr. Comerci from Integrity Dental here in Pueblo, Colorado. I want to spend a little bit of time with you today answering some questions about root canals or root canal therapy. We get a lot of questions about root canals, so good idea to answer some of them here. What is root canal treatment? So every tooth has what is called a root canal system. So there's a hollow spot in the middle of the tooth, and this is where the blood supply to the tooth and the nerve to the tooth resides. So it comes in from the tip of the root into the center of the tooth, and that's where you feel the sensation of cold and sometimes a sensation of pressure as you chew. That's all coming from inside the tooth where that nerve and that blood supply is. So root canal therapy is to get into that space, that center space of the tooth, and clean out that area and seal it when the nerve and the blood supply is unhealthy. Some signs that may indicate a need for root canal therapy include severe sensitivity to hot or cold. Now, of course, everybody's experienced sensitivity to cold and sometimes hot when they're eating their food or drink. That's normal as long as it's not really, really intense. So if you're drinking something hot or cold and it zings you to the point where you're thinking, I'm not going to do that again ever, that was really, really bad, of course, that's abnormal and could indicate a need for a root canal. It could also simply be a toothache, real intense sensitivity to sweets or salty things, or any sort of temperature changes can indicate a root canal. Sometimes just a sensation of pressure. Sometimes teeth, as they're injured or have cavities, they will slowly die and really never hurt. But then there's pressure that builds up inside the bone where the tooth has become infected and needs a root canal. Sometimes we find teeth that need root canals and are completely asymptomatic. We look on an x-ray and we see that the tooth is infected, and as the infection has worked its way out through the bone and onto the surface of the gums and is slowly draining, and you don't even notice it. So sometimes a little pimple-like thing on the side of the gums at the base of where the root is can indicate a need for a root canal. But most of the time it's a real intense sensitivity to hot or cold or the classic toothache symptoms. Can a root canal save a cracked tooth? Yes and no. Depends on how bad the crack is. When teeth become cracked, the surface of the tooth doesn't have integrity as it should, and hot and cold sensation can be translated into the center of the tooth where that nerve resides, and it can be very uncomfortable. So if the crack is relatively superficial or a minor crack, doing a root canal, removing that agitated nerve can settle the tooth down, usually followed by a crown. Sometimes a crack is so severe that even a root canal won't solve it, because although the inside of the tooth has been treated and the nerve on the outside of the tooth has been removed, there's still a lot of nerve fibers around each root. Each root is surrounded by a ligament we call the periodontal ligament that is heavily innervated. So even though a root canal has been done and the tooth is deadened per se, if that fracture is still there and can't be solved by a simple crown, it'll still flex as you chew, and the body will pick up on that. It can be very uncomfortable, and the tooth may need further treatment, sometimes needing an extraction. The other thing is if that crack is real severe, it can lead to gum disease because the bacteria now have a way to work under the gums down the side of the root, causing other issues. So to answer that question, root canal therapy sometimes can solve the problem of a cracked tooth, but not always. It'll depend. When is it too late for a root canal? That goes a little bit to the previous question. Sometimes a root canal cannot address a tooth properly if it's cracked and the crack is very severe, or if too much of the teeth structure is missing. Say a tooth is fractured and a root canal cannot save it because there's so little of the tooth structure left to rebuild. That would be a situation where a root canal really wouldn't be indicated. Or if simply there's not enough good bony support around the tooth to keep it long term. The tooth is very mobile, or you can't clean it well because there's deep pocketing. A root canal can address part of the problem, but a bigger issue would be needing to be addressed, and a root canal may not be appropriate. Or in a situation of a really bad cavity and there's just not enough good tooth structure left, it's probably best to consider going another direction. But most of the time, if caught early enough, root canal therapy is very effective. What happens during a root canal? Well, thankfully, it's a very straightforward procedure. We do it all the time. It is a bread and butter procedure in general dentistry. Root canals have a bad rap. A lot of times that you'll hear horror stories about how hard root canals can be. Most of the time, the vast majority of the time, it's very simple. What happens is you get an exam and we identify a need for a root canal, make a plan for treatment. You come in and the tooth first is anesthetized. Same kind of anesthesia you would get for a filling or any other sort of dental work. So the tooth is put to sleep. And from then on, you typically don't feel much. Sometimes nothing, sometimes very slight. And the work is done and it will feel very similar to having a filling done or a crown done, any sort of typical dental dental work. But what happens is the dentist will get into the center of that tooth, drill through the top of the tooth, get into the center where that nerve is, clean it out, disinfect it, sterilize it, and then seal it. So it's very straightforward. There are times, however, when a tooth is very, very agitated. It's a really intense, difficult toothache that is difficult to anesthetize. So there are those situations where a root canal is uncomfortable and the dentist will have a hard time getting the patient completely comfortable, completely numb, because the tooth is so fired up and the nerve tissue is not settling down or going to sleep as it normally would. But thankfully, most of the time, patients are shocked at how easy it is, how quick it is, and how little discomfort they have after the fact. How long does a root canal procedure last? Well, if done well, it can be permanent, as long as the rest of the tooth will last. We've had root canals that were done in adolescence and they'll go till the whole life. So there's no true cap on when a root canal will fail. It's not like it needs to be redone every 5 or 7 years. So if done well and covered appropriately, the root canal is at the center of the tooth and the tooth needs to be restored well afterwards with a filling or most of the time with a crown. If all that is done well, and of course the patient takes good care of it, is brushing it, flossing it, doesn't have other habits like smoking or things that can compromise the security of the bone and the ligament around the tooth, and you're not clenching and grinding or chewing on ice, of course all those things excluded, it can be lifelong, life-lasting. Now, there are certain things in root canals that you can't see coming. So the root canal system generally follows a pretty predictable pattern from patient to patient. The anterior tooth or a front tooth has so many canals. A back tooth has so many canals, and the dentist knows that before going in. But every patient is different. No two patients look alike. No two patients' teeth are exactly the same. So sometimes certain teeth have more root canal system, have a different root canal system, more root canals than you would expect. And a good dentist will be looking for that on x-rays and then in the mouth as the root canal is being done to make sure that all the canals are identified, all the canals are appropriately cleaned and sealed. Now, sometimes a canal is missed. Despite our best efforts, we don't see it or simply can't get to the root canal system and appropriately clean it. Sometimes the root canal system splits at the tip of the root where you can't get down there and clean it, and sometimes you don't even know it's there. So if it's done well and everything has been appropriately addressed to the best of our ability, they can last a long, long time. Now, if a root canal fails and it doesn't work as we expected, we always look for potentially what went wrong or what has happened. You try to find it and then readdress it. You can actually have a root canal done more than once if necessary, but thankfully that's very uncommon. Usually, if done well, the first time takes and it'll last for the foreseeable future. No need to predictably redo it again. Do you need a crown placed on a tooth that's had a root canal? Most of the time, yes. Now, why is that? Well, most of the root canals we do are on back teeth. Back teeth are where most of the chewing happens. Studies have been done on teeth that have had root canals, and unfortunately, after a root canal is done, back teeth have a much higher propensity to fracture. A tooth that's had a root canal that doesn't get a crown is 6 times more likely to fracture. So for that reason, dentists will routinely recommend crowns on back teeth that have had root canal therapy. And what are back teeth? Those are the teeth past the eye teeth or past the canines. We call them premolars or molars. So another way to say that would be every molar and every premolar that gets a root canal should have a crown put on it. Now, it's a little different if there's no tooth above it. So say I'm missing a bottom tooth or missing a top tooth and the opposing tooth needs a root canal. The root canal is done, but it's not really an active chewing. You can often get away without doing a crown because the force on that tooth is non-existent or much less. Or maybe it's opposing a denture. Well, a denture has plastic teeth. Those plastic teeth are not going to exert the same amount of force on a tooth as a natural tooth would. So some of it depends on the clinical situation, but generally speaking, back teeth, premolars and molars, do require crowns after root canal therapy. Now, the eye teeth and forward, the canines and the incisors often do not need crowns after root canal therapy, but if the root canal is due to a bad cavity or a bad fracture and is missing a lot of structure, oftentimes we will still recommend crowns to fix it appropriately. What kind of anesthesia will be used? Well, thankfully, it's the same kind of anesthesia you would get if you're getting a filling or having a tooth removed or having an implant placed or even having a deep cleaning. It's a simple round of injections in the mouth that we make as minimally uncomfortable as possible, and the tooth is put to sleep as you would for any other dental procedure. First thing we typically do is apply topical anesthetic. So it's a little jelly that we rub on the gums in the area that we're going to inject that numbs up the surface, helps the injection be a little less uncomfortable. And we have a couple distraction techniques that we'll we'll use, and then inject as gently and as quickly as possible to put the tooth to sleep. Now, there's different types of anesthesia. There's different types of anesthetics we'll use for the appropriate situation, but generally it's the same as a crown or an extraction or deep cleaning. We can also do different types of sedation. So if you're very anxious or nervous about a root canal or had a bad experience in the past, we also offer sedation. At Integrity Dental, we offer sedation. Not all offices do, but here we offer sedation that can help you be more relaxed and sedated to tolerate the procedure well and often have no memory of all that went on, so you don't have to have the memory of us working on you. But generally, anesthesia is always, local anesthesia is always required, very straightforward. Root canals, as I mentioned before, are bread and butter dentistry. We do them almost on a daily basis and sometimes multiple root canals a day. It's a very safe procedure. This has been done for decades and decades. It has tons of science to back it up that it is safe. If a tooth is infected, the best way to save a tooth is a root canal and return the patient and the tooth to health. It is a very safe procedure. How would you prepare for a root canal? Well, there's not much preparation that is necessary. You do the same thing you could prepare similarly for any other type of dentistry. Good idea would be to make sure your teeth are clean. Of course, you want to make sure that the gums are healthy before coming in for root canal. If your gums are real agitated or inflamed, it may be a little more uncomfortable for you afterwards. So as always, making sure your teeth are clean and healthy. You would probably want to take some ibuprofen or Tylenol, preferably ibuprofen if you can tolerate it, before the appointment. 400 to 600 milligrams as long as your health history doesn't contraindicate that. But some ibuprofen before the appointment not only will make the tooth feel better, of course, but it'll help you coast into the recovery period with less discomfort. So not much you need to do to prepare for one. Just make sure you understand what's necessary or what the procedure will be like so your questions are answered. Show up, of course, on time and be ready to go. And ibuprofen beforehand is a good idea. How do you feel after root canal? Well, unfortunately, that's pretty difficult to say because depending on the situation, we hear a wide range of post-operative reports. But generally speaking, and we do a lot of root canals, and we typically follow up with patients that evening or the next day. So we get a lot of feedback after we do root canals. And typically speaking, patients will say they were mild soreness. They'll report mild soreness in the area where the root canal was done. Ibuprofen, Tylenol typically covers it very well. However, the more uncomfortable the tooth is starting the root canal will often indicate more discomfort after the fact because things don't immediately heal. So although most of the time after root canal you feel better, sometimes it's still pretty uncomfortable for a day or two until the body is fully recovered. But most of the time patients will say, I was just mildly sore. So ibuprofen, Tylenol covers the vast majority of cases. Sometimes other medication is indicated, but generally it's pretty easy. But the tooth can be a little sensitive, almost always is a little sensitive to chewing after the fact. The gums may be a little tender around the area. If you're flossing and brushing, that typically will resolve within a day or two. And then chewing on the tooth can be kind of tender for a little while. Of course, the tooth has been addressed itself, but the bone and the ligament around the tooth may still need some time to settle down. So as you chew on that area, it may feel a little tender. Sometimes the bite feels a little high just from the minor swelling in the area. But most of the time we hear mild soreness. Sometimes, doc, I didn't even know you were in there. It's great. I'm back to chewing. I'm back to eating ice cream. It's wonderful. So thankfully, generally pretty mild, pretty easy to tolerate. Will your tooth be sensitive after a root canal? If your primary concern was hot or cold sensitivity, like, doc, I can't drink my ice water, I can't have anything past room temperature, it really, really hurts, that should be gone pretty much immediately because we're removing the agitated nerve that's telling the body, ouch. So that will be gone immediately. So most sensitivity that patients complain of that lead you to dental care, the toothache symptoms are resolved almost immediately or immediately after the therapy is done. However, the tooth can be sensitive in other ways. It could be very tender to chewing on for a little while because the bone and the gums need to recover for several days, and it may be tender to flossing and brushing, but generally speaking, the sensitivity is gone. Most of the time, and again, there's no exact answer that I can apply to every situation, but most of the time, 2 to 3 days and you're back to normal. Sometimes patients are immediately back to performing and eating like they would normally eat, but sometimes it's a couple days and it's tender. Depending on the situation, if it was a cracked tooth or there was an infection at the tip of that root, it can take longer, for a week, several weeks, but generally 2 to 3 days and patients are feeling much better. What is the best way to recover after a root canal? Well, you would treat the tooth like it's been injured because there's a minor injury that's led to dentistry. And then, of course, the dentistry itself is a minor trauma to the tooth just having it worked on. So you would treat it like it's been injured. So what would you do for any other injury? You try to stay away from it a little while and take it out of use if possible. So you chew, if possible, on the other side of the mouth. It may be easier foods that have less likelihood of a piece of food slipping over unintentionally on the tooth that was just worked on. So easy foods, mashed potatoes, mac and cheese, smoothies, protein shakes, those kinds of things. Avoid gum or chewing on anything hard. Ibuprofen is a great tool, a great drug. It reduces swelling and it also helps with pain. Tylenol is also a great drug for pain. You can sometimes use ice and some elevation. Those are all little things that can help. But generally speaking, just allowing it to rest and function on the other side, and ibuprofen does the trick. Well, what is the advantage of getting a dental implant, say taking a tooth out, not doing a root canal, and replacing with an implant? Or what are the advantage of trying to fight for that tooth and keep it with a root canal? Well, this is a very healthy debate in dentistry. There's advantages to both. Most of the time, to keep the tooth, if at all possible, is your best resort. It's the best possible option. What God gave you in the beginning is better than anything that we can do man-made. So that natural tooth is best whenever possible. Now, there will come a time in certain cases where the tooth is broken down or there's so much going on that it is truly best to remove the tooth and elect to move forward with an implant. So the way that would work is, okay, doc, why can't we keep the tooth? Is there any chance we could keep the tooth? Here's some reasons why you would elect to take the tooth out and move in a different direction away from a root canal and move maybe towards a dental implant. Bad fracture. So there's a fracture down the side of the tooth that's now into the root. Root canal won't fix it. A crown won't fix it. It'll continue to be uncomfortable and an infection risk. Unfortunately, once that fracture is down the side of the root far enough, the tooth needs to be removed, and implant therapy is best. Or if there's simply just not enough tooth structure. You know, I got hit in the face, or I got hit in the jaw and my teeth came slamming together and the tooth is fractured. The dentist looks in there. Oh man, yes, we can do a root canal, but there's not much tooth left to fix. Okay, probably worth moving more towards implant therapy. Or there's just not a lot. Maybe you have some advanced bone loss in the area and there's just not enough tooth structure. The tooth is mobile. Okay, you could do a root canal, but more predictable to get an implant in there. Maybe the root canal's already been done and if for whatever reason it didn't take the first time, and maybe you tried a second time and it's just not working. Do you want to try a third? Well, it depends. You know, is there a good reason why a third or a second time would predictably address the problem? Okay, maybe now we need to move more towards implant therapy. So there's good reasons on either side. It's a very individual basis that these decisions are made. But the philosophy that you should take is there's nothing as good as your natural tooth when it can be maintained healthily. So try to keep the teeth whenever possible. And a great way to do that is root canal therapy. Well, we covered this on an earlier question if you've looked through these in order, but generally speaking, the reason a crown is indicated after a root canal is because teeth after root canal therapy are more brittle. Unfortunately, they become more brittle when the inside of the tooth is cleaned out and sealed. Studies will show that they're as much as 6 times more likely to fracture. So if you're going to go through the root canal process and the investment in saving the tooth, of course we want it to last. So after a root canal on back teeth, premolars and molars, anything past that, those eye teeth, those canines, typically need crowns to protect them to avoid future fracture. How much do root canals cost? Well, a couple things depend. If you're seeing a general dentist, they are generally less expensive than seeing a root canal specialist, which we call endodontists. So it depends on the dentist that's seeing you. It depends on the office. Different offices charge different things. It also depends on the tooth. Different teeth have different numbers of root canals, and therefore there's more work involved, more technique that's involved to do it well. So front teeth are generally less expensive than back teeth. The middle teeth, those premolars, are kind of in between the front teeth and the back teeth price-wise. But generally speaking, the front teeth in a general dental office like ours will be somewhere around $800 or $900 for a front tooth root canal. And then a molar is more expensive in the ballpark of $1,200. Now, of course, that doesn't include the build-up, which kind of builds the tooth back up and gets it ready for a crown. It doesn't include the crown. That's just the root canal therapy. So there's more to it than that to get the job done. But to answer the question, root canal therapy is anywhere from about $800 to $1,200 depending on the office. And if the root canal has already been done and it needs to be redone, root canal retreatments are much more complicated and technique sensitive and are more expensive in the ballpark of $1,600 to $1,800. All right. Well, I hope we answered all your questions today regarding root canal therapy. If there's any more, or you're wondering, of course, if this would apply to you and you need a root canal, please give us a call. We're here at Integrity Dental at 719-545-2468. When you come in, we'd love to meet you, do a thorough exam. Very likely we'd get an x-ray and go through it with you and talk about options and if root canal therapy is right for you. Thanks.